How did you end up being a physical therapist?
Well, I think it was a series of events, and it started with my dad. My dad is an internal medicine physician who's also a cardiologist. And he would come home at night and tell us about the coolest patients. And they were cool because they had issues that they had to discover what they were so he could diagnose. My father, the first Dr. Dubrow, was one of the best diagnosticians in the North Texas Metroplex. He loved his job. He loved his patients, and he would come home with that enthusiasm. So I think that was instilled in me at birth. And somewhere around 5th grade, there was a bully at school. And she was a girl, and she was so mean, and she was so high and mighty on herself, and she was just mean. And back then, nobody knew from bullies, nobody knew from mean girls, and the teachers would all leave the room on recess and just leave us to kill each other. And I remember standing up on the desk one day and saying, "Nobody coronated you queen. You are not the queen of us. We're not going to take it anymore." And I think that was the first time I stood up to adversity. And I was there to protect the people who couldn't protect themselves. I don't know why. It was just something I felt compelled to do. So this is all leading up to why I want to take care of people. But it started with a bird. I went to camp, and there was a bird one day outside of our cabin that was broken. I can't remember if it was a broken leg, a broken wing, or just a broken bird. And instead of leaving it there to die, I brought it in, put a little towel, fed it, watered it, and nurtured it until it could fly again. And I think that had a lot of impact on me. And didn't know I was going to cry. Wow. So when I went to high school, I got into science. And 10th grade was biology. I thought it was awesome. So I took anatomy in 11th grade. I took chemistry in 12th grade. And I loved it. And then I knew in 9th and 10th grade, I was going to be a physical therapist because medicine was calling me, but I hate white coats. I cannot stand hospitals. And I saw my dad, as much as he loved what he did, he wore a white coat, had to walk a hospital, sat with his patient, looked at them, looked in their eyeballs and in their ears and in their mouth. And that just wasn't me. And I'm too hyper, I'm too active. I was a soccer player, a cyclist, a martial artist. I'm too hyper to sit still to be a doctor. So I went to college and became a physical therapist. And my joy is the same joy as my dad. It's to figure out what the tissue is telling me, whether it's collagen, cartilage, bone, ligament, muscle, which is the one that is causing the immediate pain that the patient is coming in, or the dysfunction. And then the bigger picture, what's the main driver behind it? Okay, so a patient comes in with a rotator cuff tear. Well, lots of people play baseball. Lots of people are pitchers. Not everybody ends up with a rotator cuff tear. Why did this kid, or this adult, or this pro ball player end up with a rotator cuff tear? That includes nutrition, it includes muscle balance, it includes how they move, why they're moving, where in the chain of events did this problem begin, so that they never have to come back to me for the same problem. Once I figure that out, I'm like the Sherlock of tissue. And that's fun. I also read murder mysteries. I want to know who did it, who's the murderer. It's like, who's the murderer in the body that's causing these issues? Then I want to give my patients the tools that they need to combat that adversity. I can guide them there. I can fix the tissue through the orthopedic manual physical therapy that I do, because physical therapy wasn't enough. That didn't give me enough tools to diagnose. That didn't give me enough tools to know how to treat those tissues directly, and then what was the driving force behind. Orthopedic manual physical therapy did that for me. And that's why I kept going for more and more and more and more, until there wasn't any more education to get. There's always more education, but there were no more degrees. And I'm happy about that. So that gave me the tools to be able to provide my patients the tools to overcome their adversity. so that they continue to improve and return to their activities. It doesn't matter whether they're a pro golfer, a pro ball player, an elite ballerina, one of the kiddos over at WOGA, the gymnasts who are going to go to the Olympics, my everyday patient who just wants to hold her baby and pick the baby out of the crib without having her sacroiliac joint go out, or my former Army veteran who just wanted to walk his dog a mile. Those are the activities that my patients want to get back to, and that's what I want to help them do so they can go back to their happy life. That was a lot.